A hospitalized client tells the nurse that an instructional directive is being prepared and that the lawyer will be bringing the document to the hospital today for witness signatures. The client asks the nurse for assistance in obtaining a witness to the will. Which is the most appropriate response to the client? 1. I will sign as a witness to your signature. 2. You will need to find a witness on your own. 3. Whoever is available at the time will sign as a witness for you. 4. I will call the nursing supervisor to seek assistance regarding your request. Answer. 4. I will call the nursing supervisor to seek assistance regarding your request. Rationale. Instructional directives, living wills, are required to be in writing and signed by the client. The client's signature must be witnessed by specified individuals or notarized. Laws and guidelines regarding instructional directives vary from state to state, and it is the responsibility of the nurse to know the laws. Many states prohibit any employee, including the nurse of a facility where the client is receiving care, from being a witness. Option 2 is non-therapeutic and not a helpful response. The nurse should seek the assistance of the nursing supervisor. 2. The nurse witnesses an automobile crash on a highway and stops to provide assistance to the victim. The nurse notes that the client has sustained a head injury and a compound fracture to the left leg. The nurse provides the appropriate care before transport of the victim to the hospital by ambulance. The client develops a severe bone infection at the site of the fracture that requires amputation of the leg and files suit against the nurse who provided care at the scene of the crash. Which is accurate regarding the nurse's immunity from this suit? 1. The Good Samaritan law will protect the nurse. 2. The Good Samaritan law will not protect the nurse. 3. The Good Samaritan law protects laypersons but not professional primary health care providers, PHCPs. 4. The Good Samaritan law will provide immunity from the suit, even if the nurse has accepted compensation for the care provided. Answer. 1. The Good Samaritan law will protect the nurse. Rationale. A Good Samaritan law is passed by a state legislature to encourage nurses and other PHCPs to provide care to a person when an accident, emergency, or injury occurs without fear of being sued for the care provided. Its protection lies in the inability to sue the nurse or other PHCP for negligence in the care provided at the scene of the accident or during the emergency. Even if further injury occurred because of the PHCP's care. Called immunity from suit, this protection usually applies only if all conditions of the law are met, such as that the PHCP received no compensation for the care provided and the care given was not willfully and wantonly negligent. 3. Nursing staff members are sitting in the lounge taking their morning break. An assistive personnel, AP, tells the group that she thinks that the unit secretary has acquired immunodeficiency syndrome, AIDS, and proceeds to tell the nursing staff that the secretary probably contracted the disease from her husband, who is supposedly a drug addict. The registered nurse should inform the AP that making this accusation has violated which legal tort? 1. Libel. 2. Slander. 3. Assault. 4. Negligence. Answer. 2. Slander. Rationale. Defamation is a false communication or a careless disregard for the truth that causes damage to someone's reputation, either in writing, libel, or verbally, slander. An assault occurs when a person puts another person in fear of a harmful or offensive contact. Negligence involves the actions of professionals that fall below the standard of care for a specific professional group. 4. The nurse in the hospital emergency department is notified by emergency medical services that several victims who survived a plane crash will be transported to the hospital. Victims are suffering from cold exposure because the plane plummeted and was submerged in a local river. What is the initial action of the nurse? 1. Call the nursing supervisor to activate the agency disaster plan. 2. Supply the triage rooms with bottles of sterile water and normal saline. 3. Call the intensive care unit to request that nurses be sent to the emergency department. 4. Call the laundry department and ask the department to send as many warm blankets as possible to the emergency department. Answer. 1. Call the nursing supervisor to activate the agency disaster plan. Rationale. In an external disaster, many people may be brought to the emergency department for treatment. The initial nursing action must be to activate the disaster plan. Although options 2, 3, and the fourth of may be additional measures that the nurse would take. The initial action would be to activate the disaster plan. 5. The community health nurse is working with disaster relief after a tornado. The nurse assists in finding safe housing for survivors, providing support to families, organizing counseling, and securing physical care when needed. Which level of prevention does the nurse exercise? 1. Primary level of prevention 2. Secondary level of prevention 3. Tertiary level of prevention 4. Quaternary level of prevention. Answer. 3. Tertiary level of prevention. Rationale. Tertiary prevention involves reduction of the amount and degree of disability, injury, and damage after a crisis. Primary prevention means keeping the crisis from occurring, and secondary prevention focuses on reducing the intensity and duration of a crisis. There is no known quaternary prevention level. 6. A nursing graduate is attending an agency orientation regarding the nursing model of practice implemented in the healthcare facility. The nurse is told that the nursing model is a team nursing approach. The nurse determines that which scenario is characteristic of the team-based model of nursing practice. 1. Each staff member is assigned a specific task for a group of clients. 2. A staff member is assigned to determine the client's needs at home and begin discharge planning. 3. A single registered nurse, RN, is responsible for providing care to a group of 6 clients with the aid of an assistive personnel, AP. 4. An RN leads 2 licensed practical nurses, LPNs, and 3 APs in providing care to a group of 12 clients. Answer. 4. An RN leads 2 licensed practical nurses, LPNs, and 3 APs in providing care to a group of 12 clients. Rationale. In team nursing, nursing personnel are led by a registered nurse leader in providing care to a group of clients. Option 1 identifies functional nursing. Option 2 identifies a component of case management. Option 3 identifies primary nursing, relationship-based practice. 7. The nurse employed in a mental health clinic is greeted by a neighbor in a local grocery store. The neighbor says to the nurse, "How is Carol doing? She is my best friend and is seen at your clinic every week." Which is the most appropriate nursing response? 1. I cannot discuss any client situation with you. 2. If you want to know about Carol, you need to ask her yourself. 3. Only because you're worried about a friend, I'll tell you that she is improving. 4. Being her friend, you know she is having a difficult time and deserves her privacy. Answer. 1. I cannot discuss any client situation with you. Rationale. The nurse is required to maintain confidentiality regarding the client and the client's care. Confidentiality is basic to the therapeutic relationship and is a client's right. The most appropriate response to the neighbor is the statement of that responsibility in a direct but polite manner. A blunt statement that does not acknowledge why the nurse cannot reveal client information may be taken as disrespectful and uncaring. The remaining options identify statements that do not maintain client confidentiality. 8. The nurse manager has involved all staff members in the development of goals and decision-making. Which leadership style has the unit manager exercised? 1. Autocratic. 2. Democratic. 3. Situational. 4. Laissez-faire. Answer. 2. Democratic. Rationale. Democratic leadership is defined as participative, with a focus on the belief that all members of the group have input into the decision-making process. This leader acts as a resource and facilitator. Autocratic leadership dominates the group, with maintenance of strong control over the group. Situational leadership is based on the current events of the day. Laissez-faire leaders assume a passive approach, with the decision-making left to the group. 9. The nurse provides an educational session on client rights. Which statement by a member of the session demonstrates the best understanding of the nurse's role regarding ensuring that each client's rights are respected? 1. Autonomy is the fundamental right of each and every client. 2. A client's rights are guaranteed by both state and federal laws. 3. Being respectful and concerned will ensure that I'm attentive to my client's rights. 4. Regardless of the client's condition, all nurses have the duty to value client rights. Answer. 3. Being respectful and concerned will ensure that I'm attentive to my client's rights. Rationale. The nurse needs to respect and have concern for the client. This is vital to protecting the client's rights. While it is true that autonomy is a basic client right, there are other rights that must also be both respected and facilitated. State and federal laws do protect a client's rights, but it is sensitivity to those rights that will ensure that the nurse secures these rights for the client. It is a fact that safeguarding a client's rights is a nursing responsibility, but stating that fact does not show understanding or respect for the concept. 10. The nurse is developing a client care assignment for a group of assistive personnel, APs. What is the nurse's first step in planning and assigning clients? 1. Determine what skills can be delegated. 2. Determine the years of experience of each AP. 3. Determine how much supervision is required for each client assigned. 4. Determine how many clients the agency allows to be delegated to each AP. Answer. 1. Determine what skills can be delegated. Rationale. Knowing what skills can be delegated is essential when nurses assign client care to other healthcare personnel. Nurses must be familiar with their state's Nurse Practice Act, institutional policies and procedures, and the institution's job description for APs. Information from these sources is necessary to define the level of competency of APs. Determining how many clients to delegate is not the first step, and in fact most agencies do not state a specific number of clients that may be assigned. Determining years of experience is also not a first step. Although a AP's experience could affect the type of client assigned, how much supervision will be required is also important but, again, not the first step the nurse takes when delegating client assignment to the APs. 11. The experienced nurse is observing a newly hired graduate nurse count opioids as part of the orientation process. The experienced nurse determines that the newly hired nurse needs further teaching about the procedure for counting opioids when which statement is made. 1. Any discrepancies in a count will be reported immediately. 2. I will record each dispensing of an opioid on the special opioids inventory record. 3. If a portion of an opioid is used, it is okay to leave it in the client's drawer to use at another time during the shift. 4. Opioids will be counted each time one is removed from the drawer and at the end and beginning of each shift. Answer. 3. If a portion of an opioid is used, it is okay to leave it in the client's drawer to use at another time during the shift. Rationale. If the nurse gives a portion of a pre-measured dose of a controlled substance, a second nurse witnesses disposal of the unused portion. Both nurses must sign the form. Leftover portions of an opioid are not saved for use at a later time. The statements in the remaining options are accurate. 12. While eating lunch in the hospital cafeteria, a nursing student overhears two nurses talking about a client. Which is the important information for the nurses to remember when talking about the client? 1. Talking about clients in public places is a violation of the client's confidentiality. 2. The client's rights to confidentiality do not apply to the break time of employees. 3. It is acceptable for the nurses to talk about a client because they are on the same treatment team. 4. The nurses taking care of the client should not share information with each other that the client has told them separately. Answer. 1. Talking about clients in public places is a violation of the client's confidentiality. Rationale. Although it is acceptable for the nurses on the same treatment team for a client to discuss his or her treatment, it is not appropriate to do so in the cafeteria or any other place, particularly when others could potentially hear this conversation. The nurse cannot violate confidentiality during the professional's personal time. There is not a time during which it is acceptable to violate confidentiality except in the case of a life or death emergency. 13. The nurse calls a client's primary healthcare provider, PHCP, to report that the client, who has heart failure, is demonstrating increased wheezes on lung auscultation and dyspnea. The PHCP is in a hurry because of involvement in a critical care situation in the hospital emergency department and gives the nurse a telephone prescription for furosemide. Afterwards, the nurse realizes that the route of the medication is unclear. Which action by the nurse is the most appropriate? 1. Call the PHCP who gave the telephone prescription and clarify the prescription. 2. Call the nursing supervisor for assistance in determining the route of the medication. 3. Administer the medication by the intravenous route because this route usually is used for clients with heart failure. 4. Administer the medication by the oral route, and clarify the prescription once the PHCP has finished addressing the critical care issue in the emergency department. Answer. 1. Call the PHCP who gave the telephone prescription and clarify the prescription. Rationale. Telephone prescriptions involve a PHCP stating a prescribed therapy over the telephone to the nurse. The nurse must clarify the prescription by repeating it clearly and precisely to the PHCP. The nurse then writes the prescription on the PHCP's prescription sheet. Under no circumstances would the nurse try to interpret an unclear prescription or administer a medication by a route that was not prescribed. The nurse must call the PHCP who gave the telephone prescription and clarify the prescription. 14. The nurse hears a client calling out for help, hurries down the hallway to the client's room, and finds the client lying on the floor. The nurse performs an assessment, assists the client back to bed, notifies the primary healthcare provider, and completes an occurrence report. Which statement should the nurse document on the occurrence report? 1. The client fell out of bed. 2. The client climbed over the side rails. 3. The client was found lying on the floor. 4. The client became restless and tried to get out of bed. Answer. 3. The client was found lying on the floor. Rationale. The occurrence report should contain a factual description of the occurrence, any injuries experienced by those involved, and the outcome of the situation. The correct option is the only one that describes the facts as observed by the nurse. Options 1, 2, and 4 are interpretations of the situation and are not factual information as observed by the nurse. 15. The graduate nurse is interviewed by the manager of a unit and is told that the manager's leadership style is laissez-faire or one of letting the staff nurses make the decisions about the unit's operations. Which question by the graduate nurse indicates the best understanding of the laissez-faire leadership style? 1. As the manager, do you maintain control and make all decisions? 2. As the manager, do you assume a passive, non-directive approach? 3. As the manager, do you facilitate decision-making within the group? 4. As the manager, do you change style according to the needs of the group? Answer. 2. As the manager, do you assume a passive, non-directive approach? Rationale. A laissez-faire leader assumes a passive, non-directive approach. Option 1 describes an autocratic leader. This type of leader would make the decisions. Option 3 describes a democratic leader. This type of leader is a talk with the members type of leader who gains input and facilitates decision-making by the group. Option 4 describes a situational leader. This is seen when a manager indicates that in some situations, the manager decides, but in other situations, the staff nurses decide. 16. The registered nurse, RN, is beginning a new job in a clinic and attends an orientation session. After the session, another new employee asks the RN to describe case management, a component of the discussions in the orientation session, because the employee did not clearly understand the concept. Which statement made by the nurse is the most appropriate? 1. Case management is an important concept, but it doesn't promote appropriate use of personnel. 2. Case management will maximize hospital revenues and at the same time provide optimal outcome of client care. 3. Case management saves money for the institution because clients with similar problems are all treated in the same manner. 4. Case management requires an experienced nurse because it represents a primary health prevention focus and is managed by a single nurse. Answer. 2. Case management will maximize hospital revenues and at the same time provide optimal outcome of client care. Rationale. Case management represents an interdisciplinary healthcare delivery system that promotes appropriate use of hospital personnel and material resources to maximize hospital revenues while providing for optimal outcomes of client care. The remaining options are inaccurate statements regarding case management. 17. The nurse takes a newly admitted client's vital signs, completes an admission assessment history on the client, and assists the client to change into a hospital gown. By completing these tasks, the nurse is demonstrating which role of the nurse. 1. Manager. 2. Educator. 3. Advocate. 4. Caregiver. Answer. 4. Caregiver. Rationale. The nurse is practicing basic nursing skills. Some of the tasks can be delegated, but the nurse chose to perform them, so the nurse is acting as a caregiver. A manager coordinates the care of a client, an educator teaches a client, and an advocate upholds a client's rights. 18. The registered nurse, RN, is planning her client assignments for the day. She has a licensed practical nurse and an assistive personnel, AP, on her team. Which task should the RN delegate to the AP? 1. Empty a client's urinary catheter bag. 2. Instruct a client on his or her new diabetic diet. 3. Teach a client how to check her or his blood glucose. 4. Evaluate a newly admitted client's home medications. Answer. 1. Empty a client's urinary catheter bag. Rationale. The nurse must delegate tasks according to the educational level of staff members. Unlicensed personnel such as a AP can perform tasks that are non-invasive, such as emptying a urinary catheter bag. Additionally, APs are not trained to teach or evaluate. Only an RN can teach, evaluate, and instruct. 19. The nurse manager is observing a new nursing graduate caring for a burn client in protective isolation. The nurse manager intervenes if the new nursing graduate planned to implement which unsafe component of protective isolation technique. 1. Using sterile sheets and linens. 2. Performing strict hand-washing technique. 3. Wearing gloves and a gown only when giving direct care to the client. 4. Wearing protective garb, including a mask, gloves, cap, shoe covers, gowns, and plastic apron. Answer. 3. Wearing gloves and a gown only when giving direct care to the client. Rationale. In protective isolation, the nurse needs to protect the client at all times from any potential infectious contact. Thorough hand-washing should be done before and after each contact with the burn-injured client. Sterile sheets and linens are used because of the client's high risk for infection. Protective garb, including gloves, cap, masks, shoe covers, gowns, and plastic apron, need to be worn when in the client's room and when directly caring for the client. 20. A registered nurse, RN, is observing a licensed practical nurse, LPN, preparing a client for treatment with a continuous passive motion, CPM, machine. Which action by the LPN requires follow-up by the RN? 1. The LPN keeps the client's knee at the hinge joint of the machine. 2. The LPN assesses the client for pressure areas at the knee and the groin. 3. The LPN places the client's knee in a slightly externally rotated position. 4. The LPN checks the degree of extension and flexion and the speed of the CPM machine according to the primary healthcare provider's PHCP's prescriptions. Answer. 3. The LPN places the client's knee in a slightly externally rotated position. Rationale. In the use of a CPM machine, the leg should be kept in a neutral position and not rotated either internally or externally. The knee should be positioned at the hinge joint of the machine. The nurse should monitor for pressure areas at the knee and the groin and should follow the PHCP's prescriptions and institutional protocol regarding extension and flexion and the speed of the CPM machine. 21. The client with a perforated gastric ulcer who is scheduled for emergency surgery cannot sign the operative consent form because of sedation with opioid analgesics. The nurse should take which priority action? 1. Send the client to surgery without the consent form being signed. 2. Have the hospital chaplain sign the informed consent immediately. 3. Notify the primary healthcare provider, PHCP, to obtain a court order for the surgery. 4. Obtain telephone consent from the family member witnessed by 2 authorized individuals. Answer. 4. Obtain telephone consent from the family member witnessed by 2 authorized individuals. Rationale. Every effort must be made to obtain permission from a responsible family member to perform surgery if the client is unable to sign the consent form. Telephone consent must be witnessed by 2 authorized individuals who hear the family member's oral consent. The 2 witnesses then sign the consent with the name of the family member, noting that an oral consent was obtained. Consent is not informed if it is obtained from a client who is confused, unconscious, mentally incompetent, or under sedation. In emergencies, the client may be unable to sign and family members may not be available. In this type of situation, the PHCP is legally permitted to perform surgery without consent. Options 1 and 2 are not appropriate. In addition, actions that delay treatment in an emergency are not appropriate. 22. An older woman is brought to the emergency department for treatment of a fractured arm. On physical assessment, the nurse notes old and new ecchymotic areas on the client's chest and legs and asks the client how the bruises were sustained. The client, although reluctant, tells the nurse in confidence that her son frequently hits her if supper is not prepared on time when he arrives home from work. Which is the most appropriate nursing response? 1. Oh, really? I will discuss this situation with your son. 2. Let's talk about the ways you can manage your time to prevent this from happening. 3. Do you have any friends who can help you out until you resolve these important issues with your son? 4. As a nurse, I am legally bound to report abuse. I will stay with you while you give the report and help find a safe place for you to stay. Answer. 4. As a nurse, I am legally bound to report abuse. I will stay with you while you give the report and help find a safe place for you to stay. Rationale. The nurse must report situations related to child or elder abuse, gunshot wounds and other criminal acts, and certain infectious diseases. Confidential issues are not to be discussed with non-medical personnel or the client's family or friends without the client's permission. Clients should be assured that information is kept confidential, unless it places the nurse under a legal obligation. Options 1, 2, and 3 do not address the legal implications of the situation and do not ensure a safe environment for the client. 23. Which identifies accurate nursing documentation notations? Select all that apply. 1. The client slept through the night. 2. Abdominal wound dressing is dry and intact without drainage. 3. The client seemed angry when awakened for vital sign measurement. 4. The client appears to become anxious when it is time for respiratory treatments. 5. The client's left lower medial leg wound is 3 cm in length without redness, drainage, or edema. Answer. 1. The client slept through the night. 2. Abdominal wound dressing is dry and intact without drainage. 5. The client's left lower medial leg wound is 3 cm in length without redness, drainage, or edema. Rationale. Factual documentation contains descriptive, objective information about what the nurse sees, hears, feels, or smells. The use of inferences without supporting factual data is not acceptable because it can be misunderstood. The use of vague terms, such as seemed or appears, is not acceptable because these words suggest that the nurse is stating an opinion. 24. The nurse has made an error in documentation of the dose administered of an opioid pain medication in the client's record. The nurse draws 1 mg from the vial and another registered nurse, RN, witnesses wasting of the remaining 1 mg. When scanning the medication, the nurse entered into the medication administration record, MAR, that 2 mg of hydromorphone was administered instead of the actual dose administered, which was 1 mg. The nurse should take which actions to correct the error in the MAR? Select all that apply. 1. Complete and file an occurrence report. 2. Right-click on the entry and modify it to reflect the correct information. 3. Document the correct information and end with the nurse's signature and title. 4. Obtain a cosignature from the RN who witnessed the waste of the remaining 1 mg. 5. Document in a nurse's note in the client's record detailing the corrected information. Answer. 2. Right-click on the entry and modify it to reflect the correct information. 3. Document the correct information and end with the nurse's signature and title. 4. Obtain a cosignature from the RN who witnessed the waste of the remaining 1 mg. 5. Document in a nurse's note in the client's record detailing the corrected information. Rationale. Electronic health records, EHR, will have a time-date stamp that indicates an amendment has been entered. If the nurse makes an error in the MAR, the nurse should follow agency policies to correct the error. In the MAR, the nurse can click on the entry, usually right-click, and modify it to reflect the corrected information. Since this is an opioid medication, the nurse should obtain a cosignature from the RN who witnessed the wasting of the excess medication to validate that 1 mg, rather than 2 mg, was given. A nurse's note should be used to detail the event and the corrections made, and the nurse's name and title will be stamped on the entry in the EHR. An occurrence report is not necessary in this situation. 25. The nurse who works on the night shift enters the medication room and finds a coworker with a tourniquet wrapped around the upper arm. The coworker is about to insert a needle, attached to a syringe containing a clear liquid, into the antecubital area. Which is the most appropriate action by the nurse? 1. Call security. 2. Call the police. 3. Call the nursing supervisor. 4. Lock the coworker in the medication room until help is obtained. Answer. 3. Call the nursing supervisor. Rationale. Nurse practice acts require reporting impaired nurses. The Board of Nursing has jurisdiction over the practice of nursing and may develop plans for treatment and supervision of the impaired nurse. This occurrence needs to be reported to the nursing supervisor, who will then report to the Board of Nursing and other authorities, such as the police, as required. The nurse may call security if a disturbance occurs, but no information in the question supports this need, and so this is not the appropriate action. Option 4 is an inappropriate and unsafe action. 26. The nurse arrives at work and is told to report, float, to the intensive care unit, ICU, for the day because the ICU is understaffed and needs additional nurses to care for the clients. The nurse has never worked in the ICU. The nurse should take which best action? 1. Refuse to float to the ICU based on lack of unit orientation. 2. Clarify the ICU client assignment with the team leader to ensure that it is a safe assignment. 3. Ask the nursing supervisor to review the hospital policy on floating. 4. Submit a written protest to nursing administration, and then call the hospital lawyer. Answer. 2. Clarify the ICU client assignment with the team leader to ensure that it is a safe assignment. Rationale. Floating is an acceptable practice used by hospitals to solve understaffing problems. Legally, the nurse cannot refuse to float unless a union contract guarantees that nurses can work only in a specified area or the nurse can prove the lack of knowledge for the performance of assigned tasks. When encountering this situation, the nurse should set priorities and identify potential areas of harm to the client. That is why clarifying the client assignment with the team leader to ensure that it is a safe one is the best option. The nursing supervisor is called if the nurse is expected to perform tasks that he or she cannot safely perform. Submitting a written protest and calling the hospital lawyer is a premature action. 27. The nurse manager is discussing the facility protocol in the event of a tornado with the staff. Which instructions should the nurse manager include in the discussion? Select all that apply. 1. Open doors to client rooms. 2. Move beds away from windows. 3. Close window shades and curtains. 4. Place blankets over clients who are confined to bed. 5. Relocate ambulatory clients from the hallways back into their rooms. Answer. 2. Move beds away from windows. 3. Close window shades and curtains. 4. Place blankets over clients who are confined to bed. Rationale. In this weather event, the appropriate nursing actions focus on protecting clients from flying debris or glass. The nurse should close doors to each client's room and move beds away from windows, and close window shades and curtains to protect clients, visitors, and staff from shattering glass and flying debris. Blankets should be placed over clients confined to bed. Ambulatory clients should be moved into the hallways from their rooms, away from windows. 28. The community health nurse is preparing to teach personnel and family preparedness for disasters to a group of parents of school-age children. Which items should the nurse plan to include in disaster preparedness? Select all that apply. 1. Flashlight. 2. Supply of batteries. 3. Battery-operated radio. 4. Extra pair of eyeglasses. 5. 4-week supply of water. 6. 4-week supply of non-perishable food. Answer. 1. Flashlight. 2. Supply of batteries. 3. Battery-operated radio. 4. Extra pair of eyeglasses. Rationale. Options 1, 2, 3, and 4 should be identified as items to have on hand as part of disaster preparedness. A 3-day supply of water is recommended, 1 gallon per client per day. Similarly, a 3-day supply of non-perishable food is recommended. A 4-week supply of water and food is unnecessary and not recommended. 29. A registered nurse is delegating activities to the nursing staff. Which activities are most appropriate for the assistive personnel, AP? Select all that apply. 1. Collecting a urine specimen from a client. 2. Obtaining frequent oral temperatures on a client. 3. Accompanying a client being discharged to his or her transportation to home. 4. Assisting a post-cardiac catheterization client who needs to lie flat to eat lunch. 5. Monitoring the amounts of fluid remaining in intravenous, IV, solution bags for a client receiving IV fluids. Answer. 1. Collecting a urine specimen from a client. 2. Obtaining frequent oral temperatures on a client. 3. Accompanying a client being discharged to his or her transportation to home. Rationale. Work that is delegated to others must be done consistent with the individual's level of expertise and licensure or lack of licensure. Based on the options provided, the most appropriate activities for AP are noted in options 1, 2, and 3. These options do not include situations to indicate that these activities carry any risk. Because the client needs to eat lying flat, the client is at risk for aspiration. Care related to IV therapy needs to be done by a licensed nurse. 30. The nurse in charge of a nursing unit is asked to select the hospitalized clients who can be discharged so that hospital beds can be made available for victims of a community disaster. Which clients can be safely discharged? Select all that apply. 1. A client with chest pain. 2. A client with a Holter monitor. 3. A client receiving oral antibiotics. 4. A client experiencing sinus rhythm. 5. A client newly diagnosed with atrial fibrillation. 6. A client experiencing third-degree heart block who requires a pacemaker. Answer. 2. A client with a Holter monitor. 3. A client receiving oral antibiotics. 4. A client experiencing sinus rhythm. Rationale. Clients should be medically stable if discharged and should be able to manage their condition at home. A client experiencing chest pain could be having a myocardial infarction and needs frequent monitoring. A client newly diagnosed with atrial fibrillation requires medication and monitoring to stabilize the condition. A client in third-degree heart block is considered unstable, especially if the client needs a pacemaker.